Joining us now, Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. Welcome to you, Doctor. I appreciate your time on this. More research is what he would like to see, and it's hard to dispute, the more we know, the better off we are. But he says some vaccines may be good, some are bad. Where do you even begin?
When someone's like RFK Jr., you can't really take what he's saying at face value because he's never named a vaccine that he thinks is good. And even vaccines that are tried and true, that have really demonstrated their efficacy over decades and decades, like the measles vaccine, he's been opposed to. He wrote to the prime minister of Samoa during an outbreak that was going on there with measles to tell people that the vaccine was actually causing the measles. So I don't believe it for a second. I don't think that he has any actual real research agenda that he wants to pursue. Basically, he has a fixed idea that's anti-vaccine, that's anti-medical technology, and he will kind of say anything. And I think you just have to kind of almost discard what he says because it's not really going to lead to safer or more effective vaccines. I think we're already doing what leads to safer and effective more vaccine and more effective vaccines.
What are your greatest concerns as more research is conducted and there's the potential that some of the mandates are relaxed with diseases like measles, whooping cough, polio?
There's nothing that more research is going to show that's going to dissuade the value of vaccines. The science, facts, reality, they're on the side of vaccines. They're not on RFK Jr.'s side. What I do worry about, though, is if he continues with this rhetoric at the state level, at school district level, you're going to start to see relaxation of vaccine requirements for school entries. People use the word mandates, but they're not mandates. They're requirements to enter into a school, for example. And then you're going to see more slippage and more outbreaks in certain states where they're already below the critical threshold, like in Oregon, for example, or Idaho. And that's going to make these diseases disruptive again and cause stress on the healthcare sector, stress on the public health agencies that are already overstressed. So I think what this does is it really elevates one of the anti-vaccine movement's biggest stars to a position where he can wield a lot more influence and even government power. And I think that's something that the anti-vaccine movement has hoped for a long time. And now they unfortunately will have it, and we will all pay the consequences for this.
So you're going to have some tough discussions, I would imagine, with a lot of patients who are curious and confused. How do you advise them to do their own research so that they feel assured in the vaccines that they're giving of the schedule?
Well, the whole phrase "do your own research" can sometimes be very nebulous because if you start looking on the internet, you might end up on one of RFK Jr.'s sites or one of his colleagues' sites and then get completely inundated with misinformation. But what I tell people is, first of all, to use their eyes. Think about what their grandparents' experience was with certain diseases like measles and whooping cough and chicken pox and influenza and all that. And just remember what happened with COVID. All of us lived through that. And we saw how things dramatically changed for the better once vaccines were available. So there's this evidence that's available to everybody. Then it's looking for trusted experts, looking for good sources of information that are coming from scientists that have an established track record of being objective about the facts, that don't have a political agenda. And that's very hard to do in this environment if you're not already exposed to it, because there is so much misinformation that lots of people can get duped. And there's even people in my field that are physicians that are purveyors of misinformation as well. So it's very challenging for the average person to navigate all of this. And I think it's only going to get worse with someone like RFK Jr. in a position of power.
How do you ease people's concerns who are worried about side effects from vaccines, which are always a possibility?
Well, side effects happen with anything you do, any drug you take, from aspirin to ibuprofen to any vaccine. And you have to weigh the risk and the benefit. So it's not as if we're asking everybody to go out and get a yellow fever vaccine, which has a lot of side effects. We're asking people to weigh the risk of getting the infection, whatever it might be, influenza, measles, COVID, against the side effects, and thinking about how that's manageable. There are ways to manage the side effects and ways to minimize them by using preventive drugs beforehand, like ibuprofen or Tylenol, talking to your doctor ahead of time. So what it is getting them prepared to know that there's going to be some side effects, and then giving them some solutions and saying that those side effects are being kind of outweighed by the benefit that you're getting from a shingles vaccine or whatever vaccine it might be. And that's kind of how you do it with any kind of medication that you give a patient. You tell them what the side effects are, and you say, I'm still going to recommend this because the benefits outweigh those side effects. And if there are serious side effects, you talk about those things. And there are multiple systems in place to pick up serious side effects from any medication, any vaccine. And that's always going on.
Yeah, do your research, but talk to a trusted provider like yourself and whoever is in your community that you've spoken with on this issue before. It can be very daunting to look at the idea of it, but certainly there's a lot of research out there. Dr. Amesh Adalja, thank you so much for stopping by as always. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider, and don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.